Good day, everyone. We are the Group 5. Today, we are going to discuss the Abdominal Aortic Aneurysm Endograft. Okay, so next is the EVAR. It is the endovascular aneurysm repair. It is a minimally invasive procedure that involves placing a bifurcated or tubular stent graft over the AAA, effectively isolating the aneurysm from the arterial circulation. Unlike open surgical repair, EVAR requires only a small stab incision that has a shorter procedure duration and allows for quicker patient recovery. So, nasabi dyan, bifurcated. Ito yung stent graft na may dalawang branch below. So, the one is for right femoral artery and the second branch is for the left femoral artery. May two ways to treat the AAA. So, first is the traditional open surgery. Yung bubuksan yung abdomen, then papalitan nila ng graft yung weak section ng aorta. Second is the EVAR. Maglalagay sila ng small incision about 1 to 2 cm sa groin ng patient. Tapos, magpapasok sila ng guide wire, catheter, first counting ng artery, then saka ipapasok yung stent graft or yung endograft sa loob ng aorta. Nasabi din dyan yung advantage ng EVAR. It has a shorter duration because it only takes 1 to 2 hours. While sa open surgery, nagtatagal lang 3 to 6 hours. So, imagine yung time na na-lessen. Second one is quicker patient recovery. Yun nga, dahil maliit lang yung incision. And then, marireduce din yung blood loss, malilesen yung tissue damage, and less pain. Hospital stay naman, yung EVAR is mas shorter because 1 to 2 days lang sila doon. While sa open surgery, 4 to 7 days naman. Okay, so next is AAA, Abdominal Aortic Aneurysm. It refers to an abnormal and progressive enlargement of the abdominal aorta, posing a significant risk of life-threatening rupture. So, ang normal diameter ng abdominal aorta is 2 to 3 cm. Pagka nag-exceed yon sa 3 centimeters, madadiagnose ka with AAA. Sa lalaki naman, 5.5 centimeter. Pag sa babae, 5 centimeter. So, pag around doon, the risk ng rupture is very high. So, kailangan mo nang mag-undergo ng EVAR kapag nag-reach ka ng 5.5 or 5 centimeters sa babae. And then, the next one is the endograft. It is the tool or device to perform the method. So, para sa mga nalilito dyan, yung EVAR is the procedure, and then the AAA is the medical condition, and then the endograft is the instrument. So, let's move on to the risk factors of AAA. The first one is the age. So, there is a higher risk for people over 65 years old. Kasi nga naman, as people age, the walls of the blood vessels, including the aorta, tend to lose their elasticity and become more fragile. This makes the aorta more prone to dilation o your paglobo and the development of aneurysm. Second is gender. Men are more likely to develop AAA than women kasi ang mga lalaki po, meron po silang larger aorta compared sa babae. So, the larger the size of the aorta, the more prone to stretching and the rupture of aorta. Third is the family history. Kung meron kayong kamag-anak na may history ng AAA, possible na yung future generation ay magkaroon din ng AAA. Fourth is the smoking. It is a significant risk factor for AAA development and rupture. Vaping is also included kasi parehas silang involved in inhaling substances that can lead to inflammation and damage to blood vessels, which contribute to the development of aneurysm. Fifth is hypertension. High blood pressure weakens the aortic wall. Sixth is atherosclerosis, hardening of the arteries. Pag hardened ng arteries can damage the elastic fibers in the aortic wall. Last is high cholesterol. High cholesterol levels contribute to the development of atherosclerosis, which weakens the aortic wall and increases the risk of aneurysm formation.
Professional involved. In the Philippines, the professional who perform abdominal aortic aneurysm endographs are generally similar to those found in other countries, though there may be some local variation based on the healthcare setting and specific expertise. The key professionals involved in AAA endograft procedure in the Philippines typically include: number 1, vascular surgeons, primary specialist, and endovascular expertise. Ang primary specialist, vascular surgeon are the primary professional who perform abdominal aortic aneurysm endograft procedures in the Philippines. Sila po yung surgeon na nag-specialize ng diagnosis, treatment, and surgical management of vascular diseases, including abdominal aortic aneurysm. Endovascular expertise. Many vascular surgeons in the Philippines are trained in endovascular surgery, which involves minimally invasive techniques like endograft placement. Some vascular surgeons may undergo a specialized training or fellowship abroad to gain expertise in this area. Number 2, interventional radiologists, endovascular specialists, and collaboration with surgeons. Endovascular specialists, interventional radiologists, often working closely with the vascular surgeon, perform minimally invasive procedure like AAA endograft placement. They are trained in the use of imaging techniques such as fluoroscopy, angiography, and CT scan para po mag-guide yung catheter and stent graft during procedure. Nurses. Preoperative care. Nurses play a critical role in preparing the patient for surgery by providing care before, during, and after the procedure. They assist with patient education, monitoring vital signs, establishing intravenous access, and ensuring the patient is appropriately positioned for the position. Yung intraoperative assistant. During the procedure, nurses assist the surgeon and interventional radiologists by handling instruments, preparing sterile fields, and maintaining a sterile environment. Yung post-operative care, after the procedure, nurses monitor the patient recovery, manage pain, check for complication like bleeding or infection, and assist in patient immobilization and wound care. Anesthesiologists, anesthesia and sedation. Anesthesiologists are responsible for administering anesthesia, either general anesthesia or conscious sedation, depending on the patient condition and specific of the procedure. They also monitor the patient vital signs during the procedure and provide pain relief after operation. Yung general anesthesia, most commonly used sa mga patient na unconscious or unaware during the procedure. Yung local anesthesia with sedation, used in some cases for patient na stable, tas yung process is less invasive or complicated. Radiologists in the Philippines, especially those specializing in vascular imaging, play a critical role in diagnosing abdominal aortic aneurysm, planning for endograft placement, and performing postoperative imaging such as CT scan or ultrasound to assess graft placement and detect complications like endoleaks.
Clinical indication. First, we have symptomatic AAA or abdominal aortic aneurysm. This refers to patients who show symptoms like abdominal pain or back pain because of an enlarged artery, which is at risk of bursting. These cases need quick treatment. The second one, we have asymptomatic AAA. Kung sa symptomatic, may symptoms. Sa asymptomatic, wala. Ito yung mga taong may enlarged artery but don't show any symptoms. These cases are treated before the aneurysm becomes dangerous. For example, a person has an AAA found incidentally during a checkup might need preventive treatment to avoid future rupture. And last one, we have ruptured AAA. Sa kanilang tatlo, ito yung worst kasi this is a life-threatening condition where the aneurysm bursts, causing severe internal bleeding. Emergency treatment is required. For example, a person who suddenly collapses due to internal bleeding might have had a ruptured AAA.
Patient preparation for an abdominal aortic aneurysm endograft procedure involves several important steps to ensure the patient is optimized for the procedure and to minimize potential complications. Here is an overview of the typical preparation. Number 1, preoperative assessment. Medical history and physical examination. Thorough review of the patient's medical history, including any comorbidities such as cardiovascular diseases, diabetes, renal issues, prior surgeries, and current medications. Imaging studies. CT angiography or MRI of the abdomen to assess the size, shape, and location of the aneurysm, as well as the anatomy of the aorta and its branches. These images help in selecting the appropriate endograft and ensuring that the patient's anatomy is suitable for the procedure. Ultrasound may be used for follow-up in some cases, but CTA is typically the gold standard for preoperative planning. Assessment of aortic anatomy. The presence of sufficient healthy aortic tissue, suitable iliac artery access, and no significant tortuosity or other anatomical challenges is critical to determine whether an endograft is appropriate. Assessment of other organ systems. Cardiopulmonary evaluation, renal function, especially in patients with pre-existing renal disease, and nutritional status. Number 2, laboratory test. CBC or the complete blood count to assess for anemia or any infections. Coagulation profile to check for any bleeding disorders. Renal function test. Serum creatinine, BUN or blood urea nitrogen, and EGFR or estimated glomerular filtration rate to assess kidney function, as contrast agents used in imaging in the procedure may affect renal function. Liver function test as part of a broader evaluation, especially in patients with liver diseases. Number 3, medications. Antiplatelet therapy. If the patient is on aspirin or other antiplatelet drugs, this may need to be managed or temporarily discontinued, depending on the procedure and the surgeon's protocol. Anticoagulation management. If the patient is on anticoagulants, Adjustments are often made, including temporary cessation before the procedure. Other medications. Review and adjust medications for underlying conditions such as antihypertensive statins, diabetes medication. Number 4, preoperative fasting. NPO status. The patient will typically be instructed to refrain from eating or drinking for at least 6 to 8 hours prior to the procedure to reduce the risk of aspiration during anesthesia. Number 5, anesthesia assessment. Consultation with anesthesia. A preoperative assessment by an anesthesiologist to evaluate the patient's suitability for general anesthesia. For most endograft procedures, general anesthesia is used, although regional anesthesia may be considered in certain cases.
So, number 6 is informed consent. Dito makikita yung discussion sa risks and benefits and review of alternatives sa procedure. At importanteng bagay ito bago magsagawa ng test, procedure, or kahit anumang surgery na matatanggap ni patient. So, dapat maintindihan muna ni patient or ng guardian niya, especially kung bata or senior yung tatanggap ng procedure, kung ano man yung gagawin at kung bakit nila kailangan ito. At mahalaga din na makita dito kung ano yung mga pwedeng alternative treatments and methods para sa pasyente. Pati na rin kung ano yung magiging benefits nito at the same time yung risk kung sakali man na tatanggi sila sa treatment. Then, number 7 is preoperative antibiotics. So, dito naman pinapainom yung patient ng antibiotics 30 minutes to 1 hour before the procedure para ma-prevent and ma-lessen yung chance na magkaroon ng infection yung patient during the procedure. Dahil alam naman natin na kahit nasabihin natin na sterile naman yung environment and yung equipment na gagamitin para sa procedure, mag-introduce kasi tayo ng foreign device which is yung stent graft na papasok siya sa aorta. So, meron pa rin risk na pwede makapasok yung bacteria sa katawan through the incision. At madalas din binibigay yung antibiotics para sa mga matatanda or senior na may other health conditions like diabetes and hypertension na pwede mag-increase ng risk for infections. Then number 8 naman is psychosocial considerations. At papasok naman dito yung emotional and social support. At before magsagawa ng isang procedure, dapat yung patient handa siya at panatag siya sa procedure na gagawin sa kanya. For example, yung patient is merong anxiety, bago mag-proceed sa gagawin sa kanya, dapat ma-address mo na ito dahil yung anxiety, alam naman natin na it can cause increased heart rate and hypertension na pwedeng makaapekto sa procedure na gagawin sa kanya. Dahil dito, pwedeng tumaas yung chances na magkaroon ng aneurysm rupture and excessive bleeding during the procedure. So, mahalaga din dapat na meron tayong guardian or kasama sa procedure na pwedeng tumulong sa atin or gumabay, especially after the surgery na gagawin sa atin. And number 9 naman is intravenous line. So, alam naman natin na yung IV access can quickly and efficiently deliver medications, fluid, and other necessary treatment during the surgery. So, dito naman, pinapadaan yung mga anesthesia at yung mga, tulad nga ng mga nabanggit ko kanina, yung antibiotics na nag-help mag-prevent ng infections and blood pressure medications para naman ma-stabilize yung blood pressure natin. At bukod dito, yung IV access, pwede rin siya maging safety measures dahil during the procedure, if ever magka-problema man or complication sa procedure, dito din naman pinapadaan yung mga emergency medications.
I will now discuss the supplies and equipment used in endovascular repair. Number 1 is endovascular stent. Endograft kit or stent, the core component is the endograft itself. na consist po siya ng stent. Yung stent po is metal mesh, cover siya ng polyester or EPTFE. Yung stent graft is tailored to the patient aortic anatomy. Kadalasan po, custom based siya based sa preoperative imaging. Delivery sheet or catheter. A long flexible sheet used to introduce the endograft into the blood vessel. Ano po siya, ini-insert siya sa femoral artery or sa ibang access points and navigate siya sa aneurysm site. Catheters. This may be used for guiding the delivery system into the aorta and positioning the graft. Different catheters may be used for deployment process.
Number 4 on our supplies and equipments are guide wires. Thin, flexible wires used to guide the catheters and delivery system through the vascular system to the aneurysm site. Guide wires play a critical role in endovascular delivery system as they assist in navigating through the vascular system to reach the target site. They serve as the foundation for delivering catheters, stents, and other therapeutic devices. Number 5 is imaging equipments. Fluoroscopy in X-ray intraoperative angiography, CT or MRI preoperative imaging, and the use of contrast media can visualize internal anatomy and structures such as blood vessels, organs, and soft tissues. They help identify abnormalities like blockage, aneurysms, tumors, and malformations. They can also be the guidance for diagnosis and procedures. Number 6, vascular access equipment. We have arterial sheets, needles, and heparin saline. They all refers to the tools and devices used to gain access to the vascular system for diagnostic, therapeutic, or interventional purposes. This equipment is essential in various procedures, including administering medications, performing endovascular surgeries, and drawing blood. Number 7, anesthesia and sedation equipment. Anesthesia and sedation equipment is critical for providing safe and controlled sedation or anesthesia during medical procedures, including surgeries and minimal invasive interventions. Number 8, surgical instruments. Surgical instruments are specialized tools used by surgeons and medical professionals to perform surgical procedures. They are designed to aid in cutting, dissecting, grasping, holding, retracting, suturing, or modifying tissues. Number 9. Vascular closure devices, or also known as VCDs. They are specialized tools used to achieve hemostasis or to stop the bleeding at the site of vascular access. Typically, after procedures like angiography, angioplasty, or other endovascular interventions. These devices are designed to reduce the bleeding, enable faster recovery, and allow early ambulation compared to manual compression techniques.
Monitoring equipment. This device used to check vital signs like blood pressure, heart rate, and oxygen levels during a procedure. Sterile drapes and gowns. This is used to maintain a sterile environment during a procedure, protecting both the patient and the healthcare team from infection. Surgical gloves and masks. This is essential for maintaining hygiene during surgeries. Sterile syringe and needles. These are used to inject contrast media or medications during a procedure, helping to visualize the inside of the body or administer drugs. For example, when performing a CT scan, a contrast agent may be injected to get clear images of blood vessels. Sutures and staplers. These are used to close cuts or puncture sites after a procedure. For example, after surgery, doctors stitch the skin back together or use staples to close the wound. Balloon catheters. These are inserted into blood vessels to help open them if they are narrowed, allowing a stent, a small tube, to be placed inside to keep the vessel open. For example, if someone has a blocked artery in their heart, doctors use a balloon catheter to open it up before inserting a stent.
The patient will be given general anesthesia. This prevents pain causes them to sleep to the procedure, allowing the healthcare provider to perform the necessary work without causing discomfort to the patient, and the medications can be delivered through an IV. A healthcare provider will carefully monitor the vital signs, like the heart rate and blood pressure, during the procedure, to assess their psychological status and identify any potential complications that might arise during the process. The surgeon will make a small cut in the groin and into an artery there. The surgeon will then insert a thin flexible tube or a catheter into the artery. The tube will be gently guided all the way to the site of aneurysm. The surgeon will use moving X-ray pictures to get to the right spot.
5-step. A stent drop is set along the catheter to the aneurysm. The stent drop is a tube made of a thin metal mesh covered with a thin polyester fabric. The tube is collapsed so it is narrow and can fit through your blood vessel. Number 6. When the stent drop reaches the aorta, it is opened up and fastened in place. The stent drop then stays in place, and blood flows through it. It protects the part of the aorta and prevents the aneurysm from bursting. Number 7. The surgeon will remove the catheter. The incision in your groin is closed and small bandage is put on the wound.
Your surgeon will perform an abdominal aortic aneurysm repair to prevent the rupture of a bulging area of your aorta. Endovascular aneurysm repair. Your surgeon will begin by making a small incision in your groin over your femoral artery. Then he or she will insert a guide wire into the artery and gently push it up toward the site of your aneurysm. A catheter or hollow tube will be passed over the guide wire and pushed toward your aneurysm. Using live X-ray pictures as a guide, your surgeon will pass an endovascular stent graft, a compressed fabric and metal tube, through the catheter to the aneurysm. Then he or she will open the graft, which will be held in place with metallic hooks and stents. Your surgeon may insert additional graft components to extend the graft into the blood vessels supplying your legs. Once the graft is in place, your blood will flow through it, not into the surrounding aneurysm sac, which will remove the pressure from your aneurysm. Finally, your surgeon will remove the catheters and close the incisions in your groin. The procedure will generally take 2 to 3 hours.
Post-procedural care is the most critical for ensuring patient safety, promoting recovery, and monitoring for complications after medical or surgical procedures, including minimally invasive interventions like vascular access or surgery. Proper post-procedural cares include observation, wound care, and pain management, and also for our guidance recovery. And as you can see on our PowerPoint, you will see the steps. And by following those steps, patients can achieve a safe and successful recovery.